My name is Jordan Knutsen, and I am an Army veteran with experience working with government, state, local, and nonprofit agencies, as well as leading and developing teams. During my service, I was fortunate enough to interact with people from all different types of backgrounds. It was through this experience that I gained a profound appreciation for selfless service and trying to make my country a better place for everyone. With previous experience living and traveling abroad, as well as having a graduate degree in international studies, I wanted to combine my passions to investigate poverty and inequality rates within the USA and how those rates compare to other Organization for Economic Cooperation and Development, or OECD, countries. I use quantitative analysis to provide insights into various social services and poverty reducing programs. Acknowledging that the majority of the OECD is more effective with their anti poverty programs, I wanted to present data that illustrated that fact and visualize through what means they support their populations. I hope to give a clear understanding of what can and should be achieved. My capstone project is titled Social Expenditure Programs Within the OECD. I picked two quotes to help introduce my capstone. The first, fundamentally, poverty is a denial of choices and opportunities, a violation of human dignity. It means lack of basic capacity to participate effectively in society. It means insecurity, powerlessness, and exclusion of individuals, households, and communities. The second is the definition of relative poverty lines, which can help us to understand poverty in relation to a standard of living. This slide shows poverty rates within the OECD. A poverty rate can be defined as the ratio of the number of people whose income falls below the poverty line, taken as half the median household income of the total population. Poverty rates vary by gender, with women typically being harder hit than men, and by age, with the youth and elderly facing higher rates. Looking at the graph, we can see some of the countries with the lower poverty rates: the Czech Republic, Denmark, Finland, and Ireland. And then moving up to the higher rates, Israel, Latvia, the United States with the second highest rate in the entire OECD, and then Costa Rica with the highest rates. I think it's fair to point out that Costa Rica was the last country to join the OECD in 2021. On this slide, we see the poverty gap across the OECD. The poverty gap is the ratio showing the average shortfall of the total population from the poverty line. It's basically showing the intensity of poverty within those countries. Looking at the graph, we see the United States and Mexico having some of the larger poverty gaps. On the other end of the graph, we see Finland and Ireland. What I thought was interesting about this graph was that in 2018, across the OECD, the poverty gap started to trend downwards. That trend became even more distinct in 2019 onwards, which are, of course, the COVID years. I think we might be able to attribute that to the amount of money that these countries were investing in their populations at the time. This slide discusses income inequality, and I've included a short clip with Joseph Stiglitz discussing income inequality and why it's so harmful for a population.
I understand that people don't want to pick up the tab for other people, but sometimes selfishness leads to even the selfish people being worse off. There's been an attempt to rewrite the rules of the market economy in ways that advantage the few at the expense of the many, and at the same time undermine the productivity of our economy, leading to short-sightedness, lack of investment in our economy and our people and technology, slowing down productivity growth. Quite frankly, it's been a disaster. We rewrote the rules once before to make the economy more unequal, and now we have to rewrite them once again to make them more equal, to give workers more bargaining rights, to curb the power of corporations, to create better corporate governance, to curb the power of the financial sector, grew from 2.5% of GDP to 8% of GDP with no evidence of any increase in productivity of our economy as a whole, and plenty of evidence of increased instability and inequality. There's been an increase in intergenerational transmission of advantage, which is another way of saying that the children of the rich have a lot of advantages over the rest. And there's no magic bullet. It's not going to be corrected overnight. I think we need a comprehensive agenda that reflects a diagnosis of some of the underlying causes. And that kind of comprehensive agenda will lead to more growth and less inequality.
Looking at the graph, we can find some of the countries with lower income inequality rates: Japan, Slovakia, Denmark, and Germany. And then over here, we can find some of the highest income inequality rates to highlight the United States as having the second highest income inequality rates across the OECD. On this slide, we see family benefit spending, which is public spending reserved exclusively for families and children. On the bottom of the slide, we can see two graphs that help show us in terms of the value in millions of US dollars that the United States is actually spending the most amount monetarily, with Germany, Japan, France, and the UK also taking those top spots. However, when we look at those same numbers in terms of a percentage of GDP, we find that the United States is among some of the lowest spending, next to Turkey and Mexico, and Denmark, Luxembourg, and Sweden are among some of the highest spending. On this slide, we see labor market programs, which refers to public spending that includes anything from direct job creation, unemployment benefits, and training and hiring subsidies. Again, on the bottom of the graph, we see that support in terms of the value in millions of US dollars. The United States takes the top spot by a large margin, followed by Germany, France, and Canada. However, when we put those values as a percentage of GDP, we're seeing that Denmark and Sweden are still among some of the top spenders, followed by New Zealand, France, and Canada, with the United States taking the 12th spot. Next up, we see pension spending, which refers to expenditures on old age and survivors' pensions. Looking at the chart, we can see pension spending as a percentage of GDP. The top spenders are France, Italy, Denmark, and Austria, who from the year 2000 to 2020 look to be spending about 12% to 14% of their GDP. Further down the chart, we can find the United States, who from the year 2000 to 2019 was spending about 5% to just under 7% of their GDP on pension spending. Interestingly, in the year 2020, the US jumped from 6.7% to 12.1%, which is a considerable leap. I think this leap could be explained by the fact that in the first 18 months of the pandemic, roughly 2.4 million additional Americans retired. What I find significant about this is that if we compare it to those top four countries, we see that their pension spending is much more stable. This leap in pension spending is also mirrored in a country like Canada, which had very similar rates, and then from the year 2019 went from 5.53% to 12.28%. In this next slide, we see healthcare spending as a percentage of GDP, and I've embedded an article from the Commonwealth Fund that I thought was really interesting. I'd like to highlight some of the quotes that really stood out to me. People in the United States experience the worst health outcomes overall of any high-income nation. Americans are more likely to die younger and from avoidable causes than residents of peer countries. Some important highlights are healthcare spending, both per person and as a share of GDP, continues to be far higher in the United States than in other high-income countries, yet the US is the only country that doesn't have universal healthcare coverage. Looking at the map, we see government and compulsory schemes as the financing option for healthcare spending. The values are in terms of percentage of GDP from the year 2020. As we can see, the United States is a clear outlier, with 15.95% being spent on healthcare, compared to Canada, which sits at 9.7%, or some of the EU countries, which we can see the highest rate is 10.91% in Germany. with many of these other countries sitting far below that rate. This next slide shows how I clean some of the data. I use pivot tables to start to help me visualize and put in perspective some of the numbers that I'd be working with. In Python, I selected the columns that I wanted to look at, dropped the unneeded data as well as some of the nulls. In SQL, I reformatted everything so that it would be easier for me to read, and I converted the currency in every single data set. I think we can conclude that countries with lower poverty rates and gaps and less income inequality can be correlated with higher spending on programs that support their populations. Although the US spends the most on healthcare and is the least effective, I believe that fact is largely due to the damaging effects of a for profit healthcare system and should be seen in stark contrast to other poverty reducing programs. I think we can conclude that social expenditure programs work and they help lift people out of poverty. A lesson I learned was that without quantifying values as a percentage of GDP in relation to other countries, you can completely portray a different scenario than what is actually happening. I had to maintain an agile mindset because I came into this project with expectations and I needed to stay flexible in order to really assess everything. I also played a product owner role, which helped me break down the workload and maintain productivity. In my next step, I'd like to continue this project by looking at specific social expenditure programs from within the top spending countries to see how effective they are at reaching their populations and exactly how many people they end up reaching. I'd like to thank Savvy Coders and my team for all of their help and support throughout this capstone project. Thank you again so much.